Hello, I'm Dr. Alvin Pelt, Behavioral Health Medical Director for Buckeye Health Plan. Welcome to Buckeye Behavioral Health video series. Providers tell us that addressing behavioral health issues and concerns can be challenging. We're hosting this behavioral health video series to discuss ways to assist you in supporting your patients. Each month, we will share best practices in addressing a variety of concerns and common behavioral health issues, and how Buckeye can help you with resources for your most vulnerable patients. The topic for today is substance use disorders. In 2019, over 4,000 people died of unintentional drug overdoses, a 7% increase over 2018. Fentanyl was the drug involved in over 75% of those overdose deaths in 2019, often in combination with other drugs. The statistics for 2020 are still being analyzed, but are expected to be even worse than it was in 2019 due to the increase in stress and social isolation stemming from the COVID-19 crisis. While about 23 million Americans are addicted to drugs, or about 10% of our population, but surprisingly, only 25% of those addicted are in treatment for their substance use disorder. And the answer is yes. People with first-degree relatives with drug addictions are at higher risk of developing an addiction. This is due to the genetic transmission of the addiction disease to the next generation. Certain drugs like methamphetamine and cannabis, commonly known as marijuana, can cause psychosis. That is when you start to see things or hear things that are not there, or you start to believe things that are not true. That is called a delusion, often paranoid type delusions. Young people under 25 are especially at risk to becoming psychotic when using marijuana. Other drugs, when used over time, can cause depression, including alcohol. Well, prior to the COVID-19 crisis, all of my new patients that were admitted for face-to-face visits were given drug screens, no matter what the reason for the visit. Another good idea is to do annual drug testing on your patients, looking for drugs that are in their system that has not been prescribed. Well, what I do is I explain it as a brain disease, where a person loses control over their social use of a drug or alcohol, and now they continue to use while facing negative consequences. There are multiple providers opening up clinics in both the urban and rural areas. You simply call to schedule an assessment. That assessment will take place either via telehealth or a face-to-face visit with precautions. The assessment is the first step in getting help for a substance use disorder. We hope that this information helps providers better understand the behavioral health challenge